Welcome to Health Affairs from A to Z. This show is brought to you by the University of Illinois at Chicago College of Nursing. And I'm Nancy Valentine, Associate Dean and a Professor of Nursing at U.I.C. College of Nursing. And today I'm going to introduce our guest in a moment, but our topic is talk therapy. Is it vital to your health? And the person that's really going to lead us through this discussion is my close associate and colleague, Dr. Cynthia Handrup. Cynthia, who's sitting here to my right, has many years of experience as a psychotherapist. She is a nurse with a doctoral degree and a lot of experience working with people in a therapeutic situation and in therapeutic environments. And she's really going to tell us a lot about her experience in doing this. She holds a doctorate in nursing practice from the University of Colorado at Denver. And she is also board certified in mental health advanced practice nursing. Now, nurses doing this kind of work is not necessarily familiar to all of our viewers, and this will be part of our interesting conversation today to acquaint you with all kinds of therapists, but also to include nurses who are doing this kind of work, which is really vital to our communities. So that her work as a psychotherapist has been for many years with a multidisciplinary group. So she works with people who are from various backgrounds who are doing this. So what we want to do today is walk through why is therapy vital to your health? Why are mental health issues as important as taking care of your physical issues? And how does therapy really work? We're going to talk about what are the processes, who does therapy, how do you find a therapist, and how do you pay for a therapist? So we've really got a lot to cover. We have a lot to cover. So I want to welcome Cynthia to spend time with us today.
Thank you so much. Thank you for inviting me.
You're welcome. We only ask the best experts in the field to join us, and you're one of them. So this program is going to start with why therapy can be vital to your health. So Cynthia, just walk us through what are the issues involved, and I'm going to just give our viewers a chance to see a list of the kinds of things where this work is really pertinent.
Sure. So these are just some of the conditions that are related to stress and anxiety and depression. They are not necessarily caused by stress or anxiety or depression, but in fact we know, for instance, that heart disease is often made worse by stress or made worse by anxiety. Hypertension, again, the cause is not anxiety, depression, but in fact anxiety can elevate one's blood pressure. Asthma attacks, the same thing. We do have a fair amount of research that now shows that with people who have diabetes are very prone to depression. Again, that we circle back to heart disease. People who've had heart surgery are very prone to depression. So these are things that we have lots of research about. Headaches is another thing. Sufferers of migraine headaches often relate stress, anxiety, depression as something that really precipitates those and increases the incidence. Irritable bowel syndrome, GERDs, any of these GI disorders are highly sensitive to stress and anxiety. And then some of the research about Alzheimer's, again, not a cause, but that stress can actually make the experience of having Alzheimer's much more intense and that sort of thing. So those are just a couple of the conditions where we know that not taking care of your mental health can make the disease process actually worse. So a lot of the referrals that we get in a private practice setting or in a mental health clinic are made by primary care providers who have patients that have these diagnoses, and they feel that learning how to handle their stress or the anxiety or treating their depression will actually alleviate some of the symptoms of the disease.
Right. When you really look at that list of diseases, it really is covering just about everything. So it could be that everybody would, on some level, benefit from counseling and therapy in this area. But some people maybe are having a harder time than others. And the other thing to really think about in looking at this list, which I'll just show you again briefly, for many of you, you may have these problems. These are long-term problems for the most part. And any kind of chronic disease condition for which there is not an immediate intervention that's going to like basically make it go away. Part of what people really often have to deal with really is the fact that it is chronic, and just the chronicity and the constant treatment and everything that goes along with that can make it very difficult. I just want to remind our viewers that this is a call-in program, so we very much welcome you sharing your experiences with us or any questions that you may have. We will make every attempt to answer it to the best of our ability. So in terms of if you feel or your treater feels that you would benefit from therapy, the question is, who do you go to? So let's talk about the kind of people that are involved, and there are different kinds of therapists. They're all different descriptions and backgrounds of people. I think it would be very helpful for our viewers to understand who does this work. So
Sure.
You've got a list here of professions that practice psychotherapy.
Sure. So I've just listed some of the most common professions that practice therapy, and they're just in alphabetical order. The top of the list are advanced practice nurses. And advanced practice nurses that are doing psychotherapy have the kind of background that I have, that Nancy mentioned. They're board certified in psychiatric mental health disorders, and in the state of Illinois, they are allowed to practice independently, so you may find them in private practice on their own, but most often they're working in a group or in a mental health clinic. And they, I think one of the things that I need to point out about some of these providers is advanced practice nurses are allowed to evaluate you for medication and prescribe some of the psychiatric medications that we use, the antidepressants and the anti-anxiety drugs. So that's kind of a key to know. In this list that we've put up here, the only professions that are allowed in the state of Illinois right now to prescribe medication are advanced practice nurses and psychiatrists. There is a bill where psychologists some who receive additional training and certification may also be able to prescribe medication, but I don't think that's really in place yet. So right now, it's either to see a psychiatrist or an advanced practice nurse. But in terms of providing therapy, so the next on the list are therapists, and our therapists are people who are trained at the graduate level as art therapists. They have a master's degree in art therapy, and what they actually do is, it's not sort of the traditional art therapy of a group doing a group art project. They actually work individually with patients, and they use art as the medium, and they work on discussing your feelings about a certain problem or whatever through the artwork that you make. So, for instance, I had a patient several years ago who was actually seeing an art therapist. It was covered by Medicaid, and this art therapist worked with her. I think they had 10 sessions and was working on expressing herself through her artwork. So they met weekly and would discuss those sorts of things.
Nice.
And it works very well for certain people who are very visual and they like to express themselves that way. It works well. The next group are clinical social workers, and there are many clinical social workers. Psychiatric social workers opposed to medical social workers is what you're looking for in this category, and they are licensed by the state to provide psychotherapy. They also are prepared at the graduate level. Drug and alcoholism counselors are people who are only certified to do drug and alcoholism counseling. Again, marriage and family counselors are also people who just provide marriage and family counseling. And then a professional counselor, the initials LPC, you might see after someone's name. They have a graduate degree, and they have gone on to get a certification as a professional counselor. It's a state certification. Psychiatrists are physicians who have gone on after medical school to do psychiatric residency, and so they are trained to do psychotherapy, and many of them have limited their practices to psychiatric medication management, but actually there are still some that are doing psychotherapy. And they usually work in a group practice where they might refer to someone else to provide the therapy. Psychoanalyst is someone who is, in this country, they are usually MDs. In Europe or other countries, they can be people who have just gone through psychoanalytic training. But they actually do the traditional several days a week, what we think of as in-depth and analytic process. They might lay on a couch and they deal with a lot of the unconscious kinds of things. Right. So there aren't too many of them around right now, but there are still some, especially in large cities like Chicago. And psychologists are people who have a graduate degree, and they do psychotherapy, and so I think that kind of rounds out the list. It's certainly, when you're going and seeking a psychotherapist or making an appointment, it certainly is very appropriate for you to ask about your therapist's background and training, and that's a very appropriate kind of question.
Right. Well, there are 9 lists of categories on this sheet of people that you can see, various backgrounds, all which have had a lot of in-depth training. How would a person know which one to go to? I mean, there are a lot of choices, so choices are good.
Choices are good.
How do people find their way to either, say, a psychologist versus an advanced practice nurse versus a professional counselor?
Sure. Well, I think the first question is, or the first thing to think about is, if you've been referred because of needing an evaluation for medication, then you need to see a psychiatrist or an advanced practice nurse, because those are the only two people who can prescribe medication.
Right.
And generally, the person who refers you, or you may know that you feel like you might need an antidepressant because your depressive feelings are extremely strong. You're having difficulty getting up in the morning. You might be having some thoughts about harming yourself. I mean, this is really something you need to take care of. So in that case, you may want to see someone who can evaluate you for medication. If you know, for instance, that it's a drug or alcohol problem, I think it's a really good route to go to seek out a drug and alcoholism counselor.
Because they're a specialist in that area.
Yes, exactly.
Right.
If you particularly know that you have problems in your marriage or in your family, you might want to seek out someone there. But I'll tell you, and we'll talk about this a little later, another key point here is, how are you going to pay for this? And if you have an insurance company, or even if you have Medicaid or Medicare, or you're in a group and you have a list of preferred providers, or you may be given a list of providers that these are the only people that your insurance will pay for.
Right.
So you might be limited somewhat to that list, although once you get that list, then you will see these disciplines afterwards.
I think that's a very important point. It's good to have choices, but your choices may be limited by your insurance or by the group that you are working with. I think that it's really important to have a little bit of a further discussion about the advanced practice nurse role, because it is a very powerful role because of what Cynthia just said. First of all, she's a teacher at the University of Illinois at Chicago College of Nursing, and you're developing some of these people to be part of the workforce. So tell us a little bit about that.
So I'm a professor in the graduate program. It's a doctoral program, and it prepares advanced practice nurses in psychiatric mental health. So we, particularly at the University of Illinois, have a program that prepares nurse practitioners within the psychiatric specialty. And so they go through it, and it's generally a 4 or 5 year program. But they do work in clinical settings. They work in some of the University of Illinois clinics. They work around the city, and they do get practice in doing psychotherapy. They get supervised. They prescribe medication. Get practice in prescribing medication and are supervised. So I think I don't want to just sort of toot my own horn, but I think one of the things I think is really special about this discipline is that we are trained as nurses first, so we understand the human body and these other medical conditions. Though we're not expert in treating them, we all have had schooling and we understand them, and we understand that aspect of it, and then we have specialized in psychiatry, and nurses tend to be very well thought of by the community, trusted, and my experience working in a multidisciplinary group is that nurses do tend to sort of they really advocate for their patients. I guess I could say that they will help you kind of navigate a lot of things in the system. So it's kind of my preference. I know we're not speaking about it today, but when we talk about someone who's delivering a baby, my preference is always to go to a nurse midwife for the same reason. I think that they kind of go that extra mile.
I think it's really worth having this discussion, and we should have another program on this exclusively, because it's not a field that most people generally are aware of, and it is a great choice. Aren't most of the people, though, that we're talking about in therapy going to be on some kind of medication? I mean, you pointed out that it's the advanced practice nurse. Let's just look at our list again. It's our advanced practice nurse at the top and our psychiatrist at the bottom of the list. Like she said, this has nothing to do other than it's in alphabetical order.
Yes, exactly.
These are the people that really can do both. They can prescribe your antidepressant or any other medication, anti-anxiety medication. They can also be helping you with your therapeutic issues. Whereas with the other folks on the list, what do they do with
So
medication?
what they have to do, and actually I do have a relationship with a couple of clinical social workers, for example, and a psychologist who refer to me when they have a patient who they're seeing in therapy and they feel needs to be evaluated for medication. One of the difficulties with that, however, is there's a wait, and you are you sort of have to. Hopefully, the person that you're seeing has a relationship with someone that can get you in to see them. Otherwise, it may be a wait of a couple months before you're able to be seen by a referral source. So, I guess that's kind of one of the issues. And actually, some of my patients have said that they really prefer seeing the same person for therapy and for medication.
Right. Well, I think that the most important thing, though, to get from this part of the discussion is that, as Cynthia said, you've got to really be with a person that you feel comfortable with, that you have knowledge of their background, their experience. This is something you should feel very comfortable in asking people to, give you information on that, so that you really develop that relationship. And how does that work? I mean, when a person comes to meet any of the people on this list for the very first time, it can be intimidating. And how do they know whether it's really going to work for them or not?
That's a really good question. I'm glad you asked that, Nancy. So what I always tell my patients, and I would tell anybody else who's starting in therapy with someone, is that I think that I tell my patients you need to give it a couple of sessions. Generally, by the third or fourth session, I tell people if there's a connection between you and the therapist. And that, if we look at research on what works in psychotherapy, the number one thing that makes the difference is not necessarily the type of therapy that one is doing or what the discipline is of the therapist, but it's the relationship that you have with the therapist that really makes a difference. So that if you don't feel that relationship, if you feel like this is not a person who I feel understands me, I feel I can talk to, I would strongly, strongly suggest that you don't continue with that person and go on and seek someone else. So give it, I think by the third or fourth session, you really have a sense about that. If you don't have it, I would move on to find someone else because it's so important for the success.
Yes, it's very practical. I mean, it's like anyone that you're going to for any service. You want to be sure that really fits your needs and who you are. Let's talk about the different approaches. There are different approaches that people may have. I mean, sometimes you're going to be in individual therapy. Often that's where it starts. A very one-on-one individual evaluation. But there may be opportunities where talking in a group and really being part of a group helps, and couples certainly, that's pretty clear. And family therapy, bringing in the children, there are a lot of issues that have to do with really the family dynamics at home, maybe not just the one individual. Tell us about how you see these different modalities working.
So I think there's a couple of things here. One is, again, this might make a difference in terms of who you're seeing, where your insurance company is saying that they will pay for those providers. So that I would say probably in the broadest sense, most people are doing individual psychotherapy. Group psychotherapy is done in a lot of sort of intensive outpatient programs. That might be a program that's connected with the hospital. Certainly, some of the drug and alcoholism programs are in group therapy. But generally, most of the treatment is going to be individual. Groups, however, are very, very can be very effective for people to get that kind of sense of community and sharing experiences with other people who have the same sorts of problems. And generally, you're right, Nancy, the individual therapist might refer you to group therapy afterwards. And couples therapy Generally, people who do individual also get referrals for couples therapy. For instance, I do in my practice. So someone will generally call and say, we're really having a difficult time in our marriage, and so I think we need to come in as a couple. And I will do that, see someone. Sometimes I might tell them that they both should be in individual therapy, and we should still meet as a couple, or sometimes we just continue on in couples therapy. But most individual therapists either do couples therapy or would know someone who does. And then family therapy, of course, is very popular with adolescent, when there's adolescent problems or child problems. And in fact, many of my colleagues who are child therapists feel that they do treat the whole family, and that the only way to do child therapy is to treat the whole family.
Right.
So I think that's
so there's something to be said for all of these. I mean, at different times of the therapeutic process. So sometimes you can start out in individual, as Cynthia said, and move into a group or couples for some period of time, because many of these problems are not something that really gets settled in a few sessions. Often you're in for a longer period of time. Let's talk about the type of therapy. I mean, not everybody is going to take the same approach. And so let's talk about the different approaches that a therapist might use that really can be very interesting in understanding what goes on. So you've got behavioral, cognitive, interpersonal, psychodynamic, and play. I think most people have never been in therapy, for instance. The first thing they would wonder is, like, what's play therapy?
Right. So play therapy, we'll start at the bottom of the list, is really the therapy that's done with young children. So very young children are not able to sort of sit and talk about their feelings, but in fact are able to express themselves through playing with. Generally, there are actually dolls that are made specifically for play therapy, maybe even a house situation, so the dolls in a dollhouse situation, and children often act out dynamics that are going on in their family.
Right.
This is play therapy is also a common thing that's used whenever there are questions of child abuse and those sorts of things. They have anatomically correct dolls that they use for that. So play therapy is something that is specifically for children. It does sound like fun, though, doesn't it?
It does. Maybe briefly just tell us about the others, because I want to get to how you pay
Of course. So I guess this list, I think, these are some of the terms you might hear talked about. I think what's most important is that most therapists who are out there practicing are using a combination of a lot of these theories. So they're using some aspects of cognitive behavioral therapy. They're using some interpersonal therapy, which focuses more on your relationships with people. And they use some psychodynamic, which looks more at some of your childhood issues, the issues you had within your family when you were growing up, and those sorts of things. So, but I would say, certainly for myself, I use an approach that is a combination.
I think that people use a whole blend of
Yes.
these. It depends, again, not only on who you are coming as the client, but really where you are in the process of therapy. Sometimes it starts with one and then sort of moves into another area of focus. Let's talk about the money part of this.
Okay.
Because a lot of times people are afraid to get into therapy because they're afraid it's going to be too expensive, that they can't afford it. Tell us about that.
So, of course, how do you pay for therapy? Well, if you have unlimited funds, you can always self-pay for therapy, and that is just pay cash for it.
How much does it cost?
So, depending, in a private practice setting, it might range anywhere from $155 to $250, depending on who you're seeing.
And that's for an hour?
That's for 45 minutes usually.
Okay.
But most people have insurance of some kind, which pays a percentage of that. Gone are the days of 100% insurance coverage. Most insurances pay generously to 80%, some pay 90%, some may pay as low as 50%, and most of the time then you're responsible for paying the other portion of that. Medicare and Medicaid both pay for psychotherapy. They have a pretty good policies for that. Medicare particularly pays for, I think, 52 visits a year. So, there certainly are programs out there. Children may have therapy paid for within school, and those of people working could certainly go to an employee assistance program.
As you can tell, there's so much to talk about in this topic. We're just going to end with where to find a therapist. There are ways to go on the web, find out all these different, these are just some prompts that you can write down, but you can find a therapist primarily by going on the web. So tell us about the first thing that someone should do.
Sure, well,
if
I think,
they feel that they have an issue.
Right.
If they feel that there's something that they need to take care
Sure.
of. What's
Well,
the,
and I
what
think
do
if,
you
you
wanna leave
know,
us
I don't
with?
know if you can make that list available to your listeners in some way. I think going
can.
on the internet is helpful, but I would say that sometimes going on Yelp may not be the best.
Right.
You know, because you don't. It's not professionals really
Right.
evaluating.
Well,
so I think to make a call to something like NAMI, the National Association for the Mentally Ill, SAMHSA, which is a government national helpline, those would be professionals that they have vetted to some extent and know something about.
Well, we have really enjoyed listening to Cynthia today. She's given us a lot of information and knowledge. I want to thank you for being with us.
Thank you.
Callers, in the next round, we want to hear from you. Take care. Bye-bye.